nursing tried to break me, and I don't like it. I don't like it. I don't know what to tell you. No joke. 6 months in, probably a little bit less than 6 months in, as a new nurse, my patient died. Like, straight up, night shift. I had literally no experience as a nurse. I'm gonna tell y'all this story because it's one of those that truly stuck with me for a very long time. I'm not gonna say it broke me. I'm not gonna say nursing broke me because I'm still here. I'm still whole. I'm still happy. But I really want to tell y'all this so that it doesn't happen to you, or if something like this does happen, you know how to navigate these waters. Welcome back to Pages of Her. Now, let me just go ahead and just let y'all know real quick. This might be one of those tearjerker episodes. Why? Because my patient actually passed away. When I tell you, it was one of the most humbling and traumatic experiences I have had as a nurse. I think I was 6 months out of nursing school, maybe even not quite so. Take yourself back to med-surg days, right? For those who may not have even went through med-surg, that's totally fine as well. But I'm pretty sure you have an experience of something that was really traumatic with a patient that you were caring for. Now, when I tell you I was med-surg night shift in inner city metro area, and I was fresh out of school, like barely 6 months out of school, and there was this like second floor, there was this overflow unit, right? On my unit, it was considered renal, a little bit of med surg. We had a little bit of overflow of like transplants and just a lot of GI bleeding disorders and things like that. But it was also, the overflow unit was also 6 floors down. So just imagine they're putting someone who just had only a couple months of nursing experience with one other nurse and one tech 6 floors down from the actual unit itself, where all of your real resources are, and his own night shift. Now, I didn't like it, not gonna lie, because I didn't like people bothering me. I didn't like people all up in my business, asking me questions, just to be nosy about patients and this and that, knowing daggone well it's a whole HIPAA violation out here, and you know I can't answer no questions. So for me, one of the things that I really did enjoy was the people that I was working with. So even though we were kind of secluded in this small area with literally no windows, the only windows that we had were from did they have windows in the patients' rooms? Y'all, I don't think they had windows in the patients' rooms. I'm going to be honest with you. I think there were there might have been like 10 rooms down there. It was one of those like circular areas where the nursing station was kind of in a circle, and then you had the rooms kind of around it, right? So that's kind of how it was. So you only needed 2 nurses down there because at the time, I want to say the ratio was 1 nurse to 6 patients. I think it's still that, to be honest with you. But so I think the max we had patient room wise was 12, because there were only 2 nurses there at all times, and then just 1 tech for that entire area. So night shift, let me just take you back. One of those things that truly gets me going, I think, is when I teach newer nurses of experiences that they could go through, or I am telling them about a crazy story that happened to me or happened to someone that I know. Because oftentimes we get to this point where we're like, okay, we've done it all, we've seen it all. But the people who we're working alongside, or the people who we're trying to like lend a hand back to help up, they've never seen some of these things, and they may not even have fathomed these things even occurring. So when I'm telling you this story, I want you to kind of take a step back and think of those instances in which you have had these experiences before, and then maybe how you can help someone else. All right, night shift. Come in, I do my rounds, right? So what, 6:45, 7 o'clock, maybe about 7:15, I do my rounds. And so I go into all my patients' rooms. This particular guy, he was a white guy, probably like 30s, 40s. He came in, I want to say it was for like GI issues. So it was nothing too crazy. I know GI issues can really have a mind of its own, but for him, it really wasn't too crazy. It was some simple nausea, vomiting. Like, it wasn't really something for me to be completely concerned about. Not to this degree of a life altering situation. So we get his vitals that evening. They're pretty fine. Nothing is crazy. I come back out. I think it might have been probably like midnight, 1 o'clock. Maybe it was after the second set of vitals or something. Something just made me go back into his room. And it could have been a round, just a normal round. I go back into his room and I'm just chatting with him. Hey, how you doing? It's Shaquila, I'm back. You know, what can I get for you? Or, you know, would you like your pain medicine or whatever it is that I asked. And he's looking at me and he's not looking at me. And then all of a sudden I could truly see this fear on his face, like this sheer amount of terror like I've never seen before. And he literally said, I can't see. Like, what? I'm sorry. Huh? Like, it was one of those moments where you think to yourself, did I just hear this person correctly? Like, am I supposed to do something? Oh crap. Oh, it's me. I'm the person. Like, I'm supposed to do something because I'm the nurse with the license and I went to school for this. And so like you have all these narratives and things going into your mind. You're like, oh my gosh, what do I do? And quickly, I mean, that whole narration in my head probably lasted like 3 seconds, but it felt like it was much longer than that. And of course, I do my quick assessment, my focused assessment on this patient. I have our tech grab a set of vitals on him. You know, got my handy dandy pen light. Hold on, my pen. Oh man, I don't have it. Dang. It's not the same pen light, so it's a different little flashlight. Hold on, it's a little flashlight. But flashlight, because I'm thinking, okay, this is a neuro. This isn't GI anymore. I mean, we have crossed uncharted territory tonight. He's not supposed to have neurological issues. He's not supposed to have anything other than some nausea and vomiting. Let me give this man some antibiotics, some anti-nausea medicine, maybe some pain medicine. Like, I shouldn't be doing all this. But here I was doing literally the absolute most for this guy. And I still don't know what really happened. I mean, this happened almost 10 years ago. So I still don't know what truly happened. But what I will tell you is that the CNO, I believe she was a CNO, or she might have been like a high level director or something like that. Because it was like midnight, 2 a.m. type of vibe. So not quite sure the CNO was there, but it was someone of higher level that was there, happened to be there that night. And she comes in. I of course call at that hospital, we call them STAT team. So like our people who are highly trained, think of them as like your ICU nurses, your ED nurses, your nurses who've been nursing for 10, 15, 20, 30, 40 years. They could tell you what that rhythm is just like with one eye closed, with haze in their faces. Like they are absolute bomb.com. So there again, I called STAT team, gave them the report, right? SBAR, y'all know SBAR, situation, background, assessment, recommendation. Gave them a quick little rundown on my patient. They come into the room, they come do their thing. I'm, typing up my nursing narrative note. I'm calling a doctor. I'm doing all the other things too, right? Like I'm not leaving the patient. Don't think I just left and said, okay, cool, they got it. Let me go take care of my other 5 people. No, I had my other team nurse that was with me, and then of course the tech, and of course the charge nurse up on that floor was able to come down and help take care of my other patients. So just to let y'all know, when anything like this happens, right, when you're feeling holes in your patient's care and something starts to kind of take a turn and go left, it is okay to say, hey, I need to really focus on this patient until we get this patient transferred to ICU, to surgery, to wherever. Because you literally cannot be all places at once. So pick up the phone, call that supervisor, call that charge, call whoever and say, hey, I need help. This patient needs meds. This patient needs a bed bath. This patient needs whatever, because I'm stuck in this room taking care of this other guy who just all of a sudden had these crazy symptoms out of nowhere. So that was something that I really did, that I do encourage you guys to kind of leverage your resources as well. So we end up giving him medications. I want to say his pressure ended up being super, super high all of a sudden, which also makes me think and this also reminds me to tell y'all that anytime you are taking care of patients and your tech or whoever is getting vital signs, please make sure those are documented literally on the spot. Like, do not allow your teammates to document vital signs 2 hours later. And I understand things happen, they may be super stressed on the unit, but it's really important for them when they get that set of vital signs to physically log it into the system, or if it's one of those highfalutin devices, they can scan it, and they can scan the patient's armband, they can scan the computer, or not the computer, I think like the Dynamap or whatever, and it should automatically populate into the system. Not every hospital system has those types of things, but if you don't have a real up-to-date set of vital signs for your patient when something happens, it's like, oh crap, you don't have documentation from your assessment in the system, you don't have the vital signs from when your tech did them, so you're kind of flying by the seat of your pants at this moment. And then when something like that happens, they don't have anything to go off of, because now they just got, all of a sudden, this happened, these vital signs reflect this crazy thing that's occurring, but the last set of vital signs was 8 hours ago. There's so many different things that can happen in an 8-hour time span. So if they don't have anything to kind of back that up, it's like, wait, where's this gap? Why is this a gap here? When you guys think about the vision, how it's in the back of the brain and all the things, they ain't gonna get too technical with y'all, not yet. But so when we're thinking about these things, I want y'all to realize how to put these things together. And this isn't just for my nurse buddies out there, right? I feel like these conversations can even be for patients. When you feel like something is not right or something isn't going well, it is truly okay to be like, yo, nurse, doc, this is what's happening to me. I'm telling you, this is not my norm. Advocate for yourself. Stand up for yourself. It's not gonna hurt your provider's feelings if you say, hey, I need this, I need that, this is what's happening, this has been happening. Let them know, otherwise they can't treat you the way you want them to treat you, or the way they should treat you. There's certain medications and things that, based on what you say, they'll administer. Certain plans of care that we'll put into place based on what you say, based on what our assessments are of you. All right, so he ends up going to the ICU. Now, mind you, I'm med-surg, it's not my forte, don't know much about that world. But he gets transferred to the ICU, and then he ends up, I want to say this was like my night 3 of 3, right? So I come back a couple nights later, and I'm like, hey, I'm checking on so-and-so. And they was like, yo, he passed away. And I'm like, what? So he ended up having a brain bleed. He ended up having a hemorrhagic stroke, I believe it was. If I'm not, like I said, y'all, it's been 10 years. But he ended up having a brain bleed. And when I tell you that I was like so shocked and like, what? I think I was getting accommodations and like accolades and people saying, oh my gosh, Shaquila, you did everything right. And of course they have to go through your charting, they have to go through your documentation, because he came in for this and he left out like that doesn't compute. So, but they're like, yeah, you did everything right, like, I guess whatever, nursing school paid off. But it was just one of those situations, I think, that really stuck with me to this day. Like, I can't imagine a new nurse going into their patient's room and all of a sudden they say, I can't see, or I can't breathe, or I can't walk anymore. Like, just things that they were doing before. And now they're saying that they can't do the thing. And it's like, and you're literally having to play detective, if you will, to try to figure out what the cause was. I was still walking this thin line of confidence and fear, right? Like, because I had all this knowledge in my mind of what it is to be a nurse and what that means. But the thing I always say is that nursing school does not prepare you for real world nursing. It doesn't, it never will, it never can. It's just too much for nursing school to try to teach you in 2 years literally nursing itself as a profession changes and evolves ever so often, that by the time you learn this thing, this has changed, and now we moved on to this and that. It's just too much. I was super new, walking that thin line of confidence and fear, still trying to look like I knew what I was doing even after that. But I did know what I was doing, but I think because of the way that the situation occurred, I felt like I might have not paid enough attention or could have caught it sooner. And those moments, those little tiny moments of regret that you know it wasn't your fault, but it still felt like I could have done more. I cared so much. I care so much. And there was a lot of different instances that occurred to me when I was on the floor, and I was a nurse on the floor. He wasn't the sickest patient I had. He wasn't, complaining of much. He was awake. He was alert. He was oriented. He was eating. He was talking. He was seeing. And then to know that somebody passed away who I was taking care of, I don't know. It's just, like I said, it's just one of those things that I don't think I can ever get over it. And not that I need to get over it per se, but I just am, I don't know what the word is. Like, I'm literally trying to search my brain for it, and it's just not coming. It's just not coming. But I know the feeling that I get when I think about this patient, when I think about him literally saying that he can't see anything, and how in that moment I was shooketh. In that moment I was so afraid, I was so scared, I was so nervous. It's wild. I know that nursing school teach you steps. You guys know that they teach you protocols, interventions, preventative measures, but they don't and they can't teach you what it's like when something major like that happens. They can't teach you how you could go on and continue your shifts, continue working as a nurse, continue to come back day after day to care for patients. Like, they can't teach you these things. I'm trying to be honest with y'all. Like, my brain was racing, my hands were shaking, I was nervous, but my spirit remained. My spirit was intact. My spirit was unwavering, because I knew that I was trained to do these things. I just hadn't had to really do it for myself per se, right? Like, I think about myself as like one of those, as a new nurse, you are now in charge of everything. You're in charge of the care plan. You're in charge of the delegation, the prioritization, the interventions. You are the coordinator and the prioritizer of care for your patient. So I'm trained in these things, right? So that's why I'm thinking to myself, yeah, my spirit wasn't messed up. Like, my spirit was still intact. So I think that was one of those things that was able to keep me sane and just like snap out of it. It's like, I did what I was trained to do. I called who I needed to call. I followed every single instruction to the T, because I did not want anything crazy to happen to this guy any more than it had already had. In between all of those steps, I saw him, I sat with him, I listened to him, I heard him, I consoled him. He was there by himself. He didn't have anyone there. Now, I don't remember if he had family to begin with, but in that moment, he was in the hospital by himself. I tried to reassure him in a way that we're going to do everything we can to figure out what's going on. But deep inside me, I think I was barely holding it together. I think I was. Like, there was no preceptor I could call and say, hey, our patient is da-da-da-da, and let them take over the reins. Like, I'm there, but my name not really on the documents. It's different because you're a trainee. When you're a trainee, all heavy burden, workload, all the things really goes to your preceptor. Yeah, I mean, you're still there to learn and grow from situations and realize how to navigate those different waters. But at the end of the day, it's the preceptor's license and signature and all the things that's on things while you're in training. Now, could you both be in trouble for something? Yeah, right? But when you finish orientation, everything is on you, baby. Everything is on you. And I know that sounds really heavy and a lot, and it is. That doesn't mean it can't be done. Doesn't mean it can't be done. And let me also just say, I think I had a couple days of orientation. I'm going to be generous and say I think I had a couple weeks. I'm just going to say a couple weeks of orientation. You know how you do residency and you have residency for 6 months, or nowadays it's technically 12 months of a residency for nurses. Back then, 10 years ago, I don't think that was the norm. I think it was weeks, maybe, I mean months, maybe I'll say more so months than a whole year. But I think your girl only had about a couple of days of orientation. I'll even give it a couple weeks of orientation with the knowledge that I had as a nursing student, and then now graduating and then being acclimated to the unit, that I was able to kind of piecemeal all the things together, which helped me save this patient even just for a couple hours. That moment humbled me. Not because I didn't care, not because I did anything wrong, not because I made a mistake, but because I learned deep in my bones that you can do everything right, every single thing right, and still lose a patient. No one prepares you for that. No one can prepare you for that. The grief, the loss, the sleepless nights that you may have from realizing that, oh man, I was there. Could I have done that? Should I have done that? And your mind just kind of goes haywire. Your mind goes haywire on those 8 a.m. drive homes when the sun is rising in the sky and you feel like you've lived a whole lifetime in 12 or 13 hours. Nobody can prepare you for that. It humbled me in a way that I can't actually describe. This wasn't my first patient that I had seen or had known passed away at that moment, but it was different. It was different. But it humbles you, it shapes you, it breaks you open, and somehow you can still grow from it. So I hope that this page has spoken a little bit to your soul, that there's something that you can take away from my experience with a patient's passing away. You're not alone. These things happen. We kind of have to figure out ways to help us cope with those situations. All right, friends? Until the next page, keep growing.